A lot of times the cancer patients have started out doing active treatments, chemotherapy, radiation, those kinds of things, but when those things are no longer helping them, that's when hospice gets involved. Initially, I think people are reluctant to talk about hospice because they just feel like they're giving up. But once they get acquainted with hospice and realize that we're there to help them make the most of the time that they have, they oftentimes are telling us, I wish we would have contacted hospice sooner, because they could have had more time to benefit from it. It's a hard conversation to have with patients because you're really changing their focus, but I think you're also changing their hope for what they want. So in the past, when they were getting active chemotherapy, they're hoping for a cure. Well, by the time hospice gets involved, that hope just changes to something else, like I hope I can make it to my daughter's wedding or something like that. The comfort-focused care is more for the patients who have probably exhausted their curative focused care, or it's not benefiting them as much as they thought it would. Or the other thing is sometimes those curative focused treatments are very hard on the patient, and so they decide they don't want to do that anymore. So then their focus becomes comfort rather than cure. I think that it's very helpful for patients and their families to have hospice involved sooner rather than later, just because they can get more out of it. They can utilize the benefit longer and really get that education and extra care that hospice provides. So we're available for the family then as they go through that grieving process after the patient passes away. So that can include supportive visits, it can be phone calls, it's mailings. We do also have a grief education class that we offer to our patients' families, so they can get together with other people and realize that they're not alone in how they're feeling, and that it's a normal process even though it's new to them. The staff who work with our hospice patients find it very rewarding work. It's important for them to be there to help the patients and their families, but it's also very emotional. We get to know our patients at a different level than patients who are in the hospital, and so our staff can go through some grieving of their own when the patients pass away. Sometimes we've been seeing them for many months, and they get really acquainted with them and their families and attached, and so it's not easy work, but it's very important work, and I think the staff really embrace that.